After more than a week of strike action, senior doctors call it quits and return to work. What's behind their change of heart is in this report from RBJ McDermott.
The industrial action that has crippled the Princess Margaret Hospital has ended, and that's effective immediately. This after the Consultant Physician Staff Association reached a tentative agreement with the government and the Public Hospitals Authority. CPSA Treasurer John Dillett says there is still improvements to be made and that the official document has not yet been signed.
We still have some minor matters that have to be decided. However, the major financial matters, by and large, have been agreed upon, and as such, we are able to announce that we will effective immediately stop our current industrial action and will be asking the members of the CPSA to return to work in their full capacity.
The CPSA has been at odds with the PHA for the past 3 years over many issues like pensions for consultants, overtime pay, increments in consultant physicians' pay, maternity benefits, and even structural issues at the Princess Margaret Hospital. The CPSA treasurer added that while the association is not completely satisfied, the negotiations are, however, at a point where they can return to work.
I will not say that we are completely happy, but I think that this group has made some form of compromise because we want healthcare to continue to improve. The government has increased their offer on a number of fronts, and as such, the membership is satisfied that it's an agreement that we can all have.
As it relates to working conditions at PHA, the CPSA says they can only hope that the PHA lives up to their end of the bargain.
We will continue to work with the PHA. We will not be a silent group. We will anticipate and expect that the PHA will make good on promises that they will support improved healthcare, improved conditions. This group will continue to be forward in the advancement of healthcare for patients as well as working conditions for staff. So that will continue.
The CPSA thanked Prime Minister Dr. Hubert Minnis for treating them as professionals and helping this process to move along a little faster. Meantime, the CPSA is expecting all details of the agreement to be completed by the end of next week. Reporting for JCN News, I'm Berthany McDermott.
The Public Hospitals Authority refuting claims made by the Bahamas Nurses Union that its issues go beyond the proposed new shift system set to take effect December 10th. That date, however, has been deferred. The PHA in a statement noted that all outstanding matters with the BNU were resolved in September and that the only outstanding issue was the new shift. Now, the authority maintains that the shift would improve the delivery of health care to patients and ensure better patient outcomes, eliminate inequities caused by the 4 nights on, 4 nights off system, establish a standardized 5-day, 40-hour work week with 8-hour daily shifts, and provide compensation for nurses scheduled to work between the hours of 6 p.m. and 6 a.m. That compensation would be a night duty premium of $1.75 per hour, paid in addition to the standard hourly pay. But BNU President Amanda Williams has told the media that nurses would rather not work than accept this new shift. Nurses this past Tuesday overwhelmingly voted in favor of taking strike action. Another case of H1N1, commonly referred to as swine flu, bringing the total to 4. The update coming from Health Minister Dr. Dwayne Sands, who said the patient was at last report in hospital.
And H1N1 has been tied to that term swine flu, but it doesn't really help the public to understand. We are concerned that everybody understand the significance of flu. So the fact that the H1N1 subtype is one of the types of flu doesn't mean that the others are not serious. And so what we'd like everybody to know is that you can protect yourself, you can protect your family, you can do it for free.
Furthermore, go get your immunization and make sure practice good hygiene. Senators pushing ahead with first reading of the compendium of bills passed in the House of Assembly yesterday. 5 proposed pieces of legislation establishing new regulations to, in particular, govern the financial services sector and bring them in line with international standards and domestic law. All in all, to avoid the potential of again having the Bahamas blacklisted.
These are bills that are necessary for the Bahamas to be fully compliant and to avoid any threat of countervailing measures or blacklisting.
his contribution yesterday, Opposition Deputy Chester Cooper accepted that the bills contain some bitter pills to swallow, but that to not act is not an option. Now, that's not to say he does not have a few reservations.
The Register of Beneficial Ownership Bill will create a non-public database for the collection and retention of demographic information of the beneficial owners of all incorporated entities. In short, it will create an electronic encrypted list of who the beneficial owners of a company is. The beneficial owner legislation intends to create a private closed beneficial ownership registry for all Bahamian companies. We must therefore ensure that in doing this, to comply, that we do not make ourselves less competitive than Cayman or BVI. It is also important that this registry be offline and not public to preserve confidentiality and guard against data protection risk.
He further suggested that if necessary, data protection laws must also be amended to preserve the integrity of the industry and sanctity of privacy. It is also important, he said, to have the framework in place to have it closely monitored and secured.
I will be frank, Mr. Speaker. This bill, which again I do support, has the potential to be problematic for the Bahamas. The database, as I understand it, is to be managed jointly by government and the private sector, and it is anticipated to be extremely secure and only accessible by persons designated under the Act.
The compendium also includes the Commercial Entity Substance Requirements Bill, the Removal of Preferential Exemptions Bill, the Nonprofit Organizations Bill, and the Penal Code Amendment Bill. The bills will in particular govern the financial services sector and bring them in line with international standards and domestic law. Failure to do so could lead to blacklisting. Senators hope to complete debate on the 5 bills on Monday, December 10th. Members of the upper chamber also proceeding with a debate on a bill that seeks to increase the threshold for a value-added tax on electricity from $200 to $300 per billing cycle. The initial bill was passed during the 2018-2019 budget communication. However, due to the rise of oil prices globally, the government opted to increase the ceiling by $100. Leading off the government's contribution, Senator Carl Bethel, however, lamented the fact that the Bahamas has failed to take advantage of the technological advances and the availability of alternative energy sources.
Going forward, we have to have a more engaged response and embrace of the emerging renewable sources of energy and move away to the extent that we can from carbon-based, non-renewable, market force-driven sources of energy.
The bill is retroactive to November 1st. It expires July 1st, 2019. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.